Hey family, I just wanted to come on here and make a video. I understand that October is Pregnancy Loss Awareness Month, and we're pretty much at the end of October. And I felt kind of compelled to just make my own video discussing my own experience with pregnancy loss. Um, I think the goal of me making this video is to, number one, share my experience with other people, um, and to let folks know that they're not alone and they're not the only one that has dealt with this. I, I have had a couple people say, well, you don't really have to tell people your business and you don't have to explain things, but although I really do agree with that, I don't feel like anyone is served by me not saying anything. Because I know that a lot of people are going through this and experiencing what I've experienced. And I think my hope is that maybe through my experience, maybe I could be a resource to other people. Or maybe just let someone know, again, who's gone through this, that they're not alone and they're not the only one who's had to deal with this. Also let them know that there's nothing wrong with you. You're not flawed. You're beautiful. You're capable. And, there's nothing wrong with you. And the other reason is to let people know that we're all human, we're not perfect. I know a lot of times on social media, we're always posting all the good things that happen in our lives, but no one's talking about the bad things that happen. And, that can cause people to feel like, there's really something wrong with them. When, ultimately a lot of people are dealing with this behind closed doors, and they just don't have anyone to talk to about it. So let's talk about my story, right? So in late August or early September, I found out that I was pregnant. Now, my story is I'm 37 years old. I had a history of fibroids, which I had removed through a myomectomy procedure. I had a polyp on my uterus, which I had removed. So it's kind of been like a journey for me to even get pregnant. And so, a few months ago, I found out that I was pregnant, and I was so excited because I've always desired to be a parent. And, it felt like, hey, this is finally happening, right? So, took the pregnancy test, shared it with my husband. So it's super excited, okay? But shortly thereafter, I had some cramping and bleeding, and I was just like, I know this is not normal, there's no way this could be normal. So I ended up going to the emergency room. And when I was there, they, did all kinds of tests, all types of blood work. They did a transvaginal ultrasound. And ultimately, after being there for hours, they let me know that it appeared that I had lost the baby, or I was in the process of losing the baby through miscarriage. So I was then told to, kind of report to the gynecologist that following week for a follow-up treatment. And I'll just stop right there and say that I do have a gynecologist that I've been going to basically my whole adult life. But when I was sent for follow-up, they did not send me there. They sent me to another OBGYN clinic or office. And that comes into play a little bit later, and I'll tell you all about that. So anyway, the next week, I left the emergency room extremely sad. I cried. But I was able to wrap my mind around miscarriage. I really was. I was like, okay, I'll be okay. I'll be okay. So when I went the next week to the gynecologist appointment, I was fully prepared to kind of discuss miscarriage and what had happened and just kind of process all of those emotions. So I went there for follow-up. I think they did another ultrasound, some more blood work. But let me back up and say, when I got there, there was a medical student there who was a male. There was a resident there who was a male. And there was a supervising gynecologist who was a male. That's problematic for me, right? Or it became problematic. But the lead gynecologist was a white man. And I will say I've had white male doctors before who are excellent. But I think sometimes when it comes to gynecological issues, a lot of us prefer to have a female doctor, right? Anyway, so let's move on. So the doctor basically tells me, not only is it a pregnancy loss, but that I am having an ectopic pregnancy. So what does that mean? It means that my egg or my baby is not in my uterus. It's somewhere else that it's not supposed to be. It didn't implant there. And they felt that it could be my ovaries or my fallopian tube. Basically the baby was somewhere where it wasn't supposed to be. And that makes it a lot more urgent because, for example, if the baby's in my fallopian tube could rupture, which could cause internal bleeding, which could actually kill me. Ectopic pregnancies can be deadly. So, y'all just think about, where my mind is, right? So I'm like, okay, I'm pregnant. I'm happy. Okay, I'm having a miscarriage. Okay, my pregnancy is ectopic and it could possibly kill me in this very urgent situation. So the doctor presented me with several options, but I think the top two options were we could have basically immediate surgery to remove my fallopian tube. And let me tell y'all, I was not emotionally, mentally prepared to go into another surgery. In 2018, I had a myomectomy to remove my fibroids, which had me out of work for quite some time. I had 6 fibroids, okay? In 2019, I had a polyp removed from my uterus, which was a little bit less invasive. But here we are in 2020, you're telling me I need to have surgery once again. And my mind just couldn't fathom that. I'm just like, I don't know if I can go through another surgery, So that was one option. Another option that was given was, let me back up. The other part of this, having the surgery, is that in that moment, I felt like research. And this is how the doctors made me feel, right? And I'm not saying that the advice that they gave me in terms of having surgery was wrong, right? But what I'm saying is the manner in which they told me made me feel very mistrustful of them. And a lot of you know the very complicated relationship between African American people and the medical profession, right? A lot of us have been used as basically guinea pigs, have been used for experimentation, for research. And I'm not at all implying that that's what the doctor was trying to do with me, even though he was there with a resident and a med student. But what I'm saying is that was a trigger for me. I don't know if that makes sense, but that was a trigger for me. And I was just like, I don't think I trust y'all to perform surgery on me. I felt a way. I can't even articulate it, but I think a lot of you know what I'm getting at. So the other option was to take an injection of a drug called methotrexate, which is basically a very low dose of chemotherapy, just to give you an idea what that is. So I'm just sitting there. I was like, I need a minute. Can y'all just leave the room? My mom was there. And, the rough thing about going to the doctor or the hospital during COVID is you can only have one person with you. So it's like, my husband's back there with me, but I can't have my mom there. So they have to like swap so my husband can leave and then my mom can come, but none of us can all be in the same room at the same time. And I just needed to talk through it with somebody. And so my husband and my mom were both like, you need to get a second opinion. You need to, talk to somebody. They're pushing this surgery or this injection on you. And we do understand that it's urgent, but you just need to give yourself a day or two to just think through what you want to do next. And I'm grateful that they were there to kind of help me with that, because I was paralyzed. Like, I was sitting in the doctor's office like, I don't know what to do. I couldn't even think. You know what I'm saying? Like, it just felt like a movie. It felt unreal. So anyway, what happened next? I went home and I prayed about it. And I went back. So let me also share one more thing about my care while I was there. Every time I went, I had a different gynecologist. But that's the way they do business at this particular hospital. And all the while, I'm like, I have my gynecologist that I've had my entire adult life. And it didn't click in my mind to advocate for myself and say, I need to go see my regular gynecologist. But every time I'm going, I'm getting a different gynecologist, whoever's just on call and who's there at the time. And I felt like I wasn't getting the level of care that I needed. We'll come back to that. Anyway, so I ultimately decided to get the injection done. The medicine had to come from the cancer center. The medicine is extremely strong. Again, it's a low dose of chemotherapy. It causes you to feel nauseous. It causes dizziness. It causes extreme fatigue. Like, can't even stay awake. Just want to lay down. But I ultimately got the injection. I think they injected it either in my thigh or my buttocks. I can't remember. Very painful, burning sensation. My mom was there when I got it, and I cried the entire time. The entire time. Because even though I knew, well, let me back up and tell you how methotrexate works. So methotrexate basically prevents a particular type of cell, I believe, from growing. So ultimately what happens is that you get the injection and then your pregnancy hormone starts to decline until the point where your body basically absorbs the pregnancy. So I'm getting the injection and I'm crying because even though I know that my pregnancy isn't viable, I just feel away. Like, I'm having a lot of emotions. Like, I'm proactively doing something to end my own pregnancy. And that was very hard. Very, very hard. Even though I knew it wasn't a viable pregnancy, it just took a toll on me emotionally, right? So after you get the injection, you're supposed to report back to the doctor on a weekly basis. And again, your pregnancy hormone is supposed to decline. And once your pregnancy hormone gets to 5 or less, then they believe that your body has successfully kind of absorbed the pregnancy and the ectopic pregnancy is ended. But after you get the injection, you're not completely good, right? So there's still a small chance that your fallopian tube could rupture. So it's just a very stressful time, right? So not only are you nauseous, sick, sleepy, feeling a little bit dizzy, really don't have a great appetite. On top of that, you have to monitor your own body. Like, oh, I felt a little pain. Is that a sharp pain? Could that be an indication of internal bleeding? Um, am I not feeling like myself? Do I feel faint? Is all you're having to self-monitor yourself. So even though you've taken this injection, it's still a journey, it's still a process, right? And it's just very stressful. I remember laying in the bed at night, like, full of anxiety. Like, is my stomach hurting? Is this hurt? Am I going to be okay? Am I going to wake up in the morning? Is something going to happen at night? So that's what the process was for me. Ultimately, like I said, every time I went back, I had a different doctor. That's the way they do business over there at that particular hospital. So at some point, I talked to another doctor who I had seen earlier in the process. And she was like, I think I'm going to call and advocate for you. Because I understand you're not getting the level of service that you need. And it's really hard to get that level of service when you're seeing a different doctor each time, because all they have to go by is the notes that were written by the previous doctor. You know what I mean? So anyway, she actually encouraged me to advocate for myself. And I reached out to my regular OBGYN office, and I was like, I can't keep coming out here to this other office. I need you all to fit me in, and I need to be seen by my gynecologist, which is a Black woman, because that's who I felt comfortable with. And so I advocated for myself, and I refused to get off the phone until someone would talk to me and get me in there. And it worked. And, my regular gynecologist saw me, and she was just like, everything that's happened is something, or every recommendation that was made to you is something that I would have recommended. She said, up until this point, you have done the right thing. I would have done exactly what you did. And that gave me such a feeling of relief, because the whole time I questioned, am I doing the right thing? Did I do the right thing by having the injection? Should I have had the surgery? Should I have not done anything at all? So I felt like she kind of validated my feelings and the steps that I had taken prior to coming back to her. So I said all that to say, don't be afraid to advocate for yourself, and let people know what you need, right? So anyway, got the injection, kept going back to my regular GYN for blood work. And there's so much comfort in just being able to see the same face. I just can't stress that enough. It's so much comfort in just being able to deal with the same folks. Some feeling of familiar, right? So anyway, kept going back. My pregnancy hormone was declining. If it had not declined, I probably would have had to have another injection of the drug, but thankfully I did not. What else? So, that's where I am. In terms of how I've been coping, I have been journaling. I do plan to, in the future, schedule some sessions with a therapist to kind of talk through it. I have looked online for resources that could help me, and, different groups specifically with respect to, I found specific groups with respect to Black women in pregnancy loss or infertility. So those have been some really good resources for me. And again, I made this video to let you all know that if you've experienced this, if you are experiencing this, or if you experience it in the future, you're not alone. Again, one of my Instagram friends said, sometimes it feels like we're a club with invisible members, right? Because nobody talks about it. And I made this because when I was going through all this, I didn't know anybody who had had an ectopic pregnancy. I knew people who had miscarriages, but not ectopic pregnancy. So that's why I made the video. If you know someone who's going through it, feel free to share my experience with them. If you're going through it, feel free to reach out to me or message me. But if you have experienced this, even if you had to have your fallopian tube removed, it doesn't make you less of a woman. You are beautiful. You are not flawed. You are perfect. And I think we're all believing God for our miracle babies and our rainbow babies. So I want everyone to stay encouraged. Thank you for taking the time to watch this kind of long video. And I hope you guys have a great weekend. Talk to you later.